Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here in the studio. Get your free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword is written by Suzanne Summers, and Dr. Darrow appears in her new book, A New Way to Age, on pages 302 to 316. So that number again is 866-870-5752. And right now we're speaking with Christine.
So Christine, this is Dr. Marc Darrow. You still with us?
Yes, I'm here.
Okay, let me just say a few things. I've got a little bit of your history here. You've got joint pain all over the place, and you're getting an SI injection next Wednesday. That's the sacroiliac joint. And you've been lifting and landscaping for 24 years. God bless you for that. That's a tough job. I can always use you too in my house. You've had tennis elbow, golfer's elbow. What other parts of the body have bothered you or bother you now?
Well, so when I wake up in the morning and throughout the day, it's tennis elbow, golfer's elbow on both arms. It's
sure.
Plantar fasciitis.
Oh wow! Okay.
I have two bulging discs in my neck that are not too serious. They're small, but I do have not constant. But when it gets bad, my shoulders and my neck hurt. You know, I carry most of my
sure.
in those areas, and wrong lifting, of course.
Okay. Do you mind if I respond to a little bit of what you've told me so far?
No, please do. I could go on forever.
I know, but I think I can get to the basis of what's happening here. Number one, everything you have is normal. That sounds weird, right? It's not weird because you overuse your body in your work.
Yes, I know.
You know, that's not, what you have is common to everybody like you. You're like a full-time athlete, more so than athletes. You work harder than athletes, and you've been doing it 25 years or 24 years. So my God, everything you have is normal. None of it is bad. And most of it, without even touching you, I can tell you that I could help, okay? Normally I say you need an examination before I can tell you, but with someone who just has all these overuse injuries, they're usually pretty easy to help. And I know, how do I know? Because I'm one of them. I'm just like you. I'm 73. I've been working out since I'm a little boy. I used to run everywhere when I was a kid. And I got into every sport possible. I was a gymnast in high school and college. And I actually did gymnastics up until my 40s. Windsurfing, tennis, golf, weightlifting. I run in the mountains where I live in the mornings with my husky dogs, full speed. And I love to move my body like that. But I have to admit, I get injured frequently. And what do I do when I get injured? I have my tools at home. I can inject myself at home. But very often in between patients at the office or after work, when I have an injury, I'll just inject myself. And I use, at the office, I use platelets from my blood, or I've done stem cells on my knees and shoulders. I've done both my elbows, my wrist. What else? My low back. You're talking about getting an SI injection. Now, I'm not going to tell you what to do because that's your business. You're not my patient yet. If you become my patient, I'll tell you what to do. But if that's my low back, I'm not going to do an SI joint injection because they're going to stick a steroid in there. Steroids like cortisone are really not so good for us for many, many, many reasons. I don't use them in my practice except rarely. If someone comes in with low back pain and they're bent over and they can't stand up or they're listing over to the side, I might use a steroid then, cortisone type injection. There's a lot of steroids that could be used. And in 1 minute, they're going to stand up straight. The problem is it eats away the tissue. If you stick it in a joint like a knee, it's going to eat away the cartilage, soften it up. So I don't do that. And traditional medicine does that. It's done all day long, all around the world. I know that, but that doesn't make it right. Okay? So I'm going to bet you anything. If you were to come in the office before you got your shot in the SI joint, sacroiliac joint on Wednesday, and I touched the area and I found that it was tender to touch, I could heal it without sticking a steroid in there by using platelets and or stem cells. Okay? I'm not going to tell you that getting a steroid injection there is going to kill you. It's not that. It's just not a great treatment in my book. I'm not God. I'm not the God of medicine. It's just my book is different than other people's books, and a lot of doctors don't like me because of the way I talk about medicine. I want things that heal people, not Band-Aids that cover things up and make it hurt worse later. Does that make sense to you?
So, yeah, the thing is, though, is that over the past year, I already had one, and this is the past year, I had one epidural, and then I had trigger point, and all of those injections were cortisone and steroids. So I don't want to have the softening of the tissue. And since I already have injections in the past year, I should probably make an appointment with you as soon as possible because I have received PRP in my face, for beauty reasons, aesthetic reasons.
Yeah, vampire facelift, yeah.
Yeah, totally. So, so I need to come in and see you because I'd rather heal with my body's own, help than just steroids. Because what if it doesn't work? And then what if I have too much steroids? And what if I get softening in the most important area, which is your midsection, your lower back? That's very important for me, for my work, for my life.
Well, it's true. I mean, look, I'm not saying that steroids are the devil, okay? They're used all day long in traditional medical offices. I'm just saying in my practice for the last 25 years, I have found that regenerating the area is a lot healthier and works, it just works better than sticking a steroid in there as a Band-Aid that actually diminishes the tissue. And I'll tell you the worst story I ever saw with steroids. A woman came in with tennis elbow, like you have, heavy-duty tennis player, and she had so many steroid shots over the years that tendon, that extensor tendon on the elbow, pretty much dissolved away. She couldn't pick up her wrist. And I injected it over and over and over and over, and it was back in the old days when we used dextrose called prolotherapy. And it regrew that tendon, and she was able to go back and play tennis. So I've seen miracles with this stuff, and I've seen times when it doesn't work. And the reasons it doesn't work generally are because people get too active after a shot, and they don't let it heal, or they're taking anti-inflammatory medicines. We're trying to inflame the area. Even though it's inflamed, we want to kick up the inflammation quickly and bring fibroblasts to the area. So things like ibuprofen after doing regenerative medicine are not a good thing. And another reason is people don't get enough treatment. They may get it done once or twice and go, it didn't work, when it might have been that third time that grew enough tissue to actually help it heal. And then a lot of doctors don't use ultrasound to look into the body to guide the needle. They're just guessing where they're putting the needle. That's no good. And then occasionally, and this happens when we see people that go to chiropractors who hire a doctor or nurse for the day to do the injections. Those guys don't know what they're doing. So I hear this all the time. People come and they go, well, I had stem cells. I had PRP in the shoulder. And I go, how many pokes did you get? And they go, well, I had 1 or 2 pokes. That's not the way you heal a shoulder. when I inject a shoulder, I'm going to probably do 20, 30, 40 injections at one time real quickly because it's very complex. So, you have to be educated on how to do this work. You can't go to a weekend seminar and then start doing it and think you know what you're doing to help people. Anyway, we got a lot of callers here, Christine. God bless you. And if you get into the office,
as soon as possible.
Yeah. All right. God bless you. And there's good luck in healing your back and all these other things by using platelets or stem cells. We're going to go to Tony. Tony, thank you so much for calling. Your foot is bothering you. Got a lot of foot stuff today. What part of your foot? What part of your foot?
It's my friend. I had a question regarding Freeberg disease. So he braked very heavily during a car accident, and his toes curled up, and it caused nerve damage to his metatarsals, and he was diagnosed with Freeberg disease. I'm wondering if you had any ideas for that.
Yes, I do. I think, did we have someone called last week about it, or I just had an email about it? Maybe it's the same person.
No.
So I can't heal the disease part of it, okay? But I can help heal the arthritic part of it. So the answer is yes and no. I have to examine the person. The person has to come in the office. I have to examine them. The number of the office, if you want it, is 800-300-9300, 800-300-9300. I have to touch the area, see where the pain is coming from. If it's coming from a collapsing joint and there's pain there, I can probably help them. But to get rid of the total disease of the issue that's causing it, I have nothing I can do to help that. There may be some people doing experimental research on stem cells for that, but I'm not doing that in my office, okay?
Will
Make
it help
sense?
to regenerate the tissue that was damaged in the necrosis?
Yes, but I'm not sure. I have to examine it to see if what I do will regenerate enough tissue to give your friend relief, okay?
Okay, well, thank you for your time then.
God bless you, Tony, and God bless your friend, yeah. So let's get some more callers. We got a couple more here waiting. If you want to give me a buzz, we have a few minutes left. The phone number to talk to me live is 866-870-5752. When you call, you're going to get a free copy of my book, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the work I do in regenerative medicine is to regenerate the body, help the tissue grow back instead of cutting out tissue and destroying the area. So we have Mikhail here. His neck is bothering him. Did I pronounce your name correctly, Mikhail?
Yes.
Okay, good. And
yes, hello?
Yes, sir. How long has your neck bothered you for?
Since 2002.
Okay, so you got about 20 years of pain.
Yeah, and in 2007 they did a second neck surgery and put a Medtronic cage in there, two double fusions, and the morphogenic protein, two double portions of morphogenic protein derived from cows that causes cancer, death, and about 8 other side effects.
Okay. So what I'm hearing, you haven't said it, but what I'm hearing is you had 2 neck surgeries, but you still have neck pain. Is that correct?
Yes.
Okay. So this is what I hear all day long in my office. The same story, different parts of the body, all parts of the body, to be honest with you. People get these surgeries that the surgeon says is going to fix them, and they get worse. And you've had 2 surgeries. God bless you, sir. I'm sorry you've gone through all that. I get people in the office all day long.
I was on my back. I was on my back for 9 years, and only got up about 96% of the time was I able to get up in a neck brace and a walking cane.
Okay. Well, I'm so sorry. That really it makes me emotionally sad to hear stories like this. It really does. So I'm so sorry you're going through this. The question is, can regenerative medicine help get rid of your neck pain? The answer is, I don't know. I have to touch the area and see what's going on. Was your surgery in the back of the neck or the front of the neck? Or both?
The second surgery was in the front of the neck and the back of the neck.
Okay. I have to touch the area, and if you do decide to come in, I'll need some x-rays after the surgery to see where that cage is and see if it would get in the way of injections, okay? So I don't have an answer for you yet, but it would be great for you to call the office at 800-300-9300, 800-300-9300. Come in, but if you have an X-ray, bring it in. Otherwise, come in anyway, and we'll get you X-rays the same day, and I can see if it's an area. I have to touch the area and see if it's something that I can help. Okay? I don't know the answer. At this point, I can tell you I've helped tons of people who have had neck surgeries, back surgeries, shoulder, elbow, wrist, toes, knees, hips, blah, blah, blah. They've had the surgeries that failed, made them worse, and regenerative medicine's made them better. And guess what, Mikhail? I had a shoulder surgery when I was in medical school doing orthopedic surgery. It ruined my shoulder, and I went for years without being able to do sports. I was miserable. And then I learned about this. I injected my own shoulder one time, laying in bed with my wife watching TV with her swearing at me because I was injecting myself. And I swear to God, I woke up the next morning, my shoulder had complete range of motion, which it didn't have before, and I was completely pain-free. And I went, this is a frickin' miracle. It's not a miracle on everybody. I'm just letting you know what my experience was. Same thing with my right wrist. I got injected one time, woke up, actually wasn't waking up, it was about 24 hours later, so it was later in the day. And my wrist was 50% better. I then self-injected it a few times, and I'm going to go hit golf balls for a couple hours today. My wrist is fine, okay? I'm not telling you I'm going to be able to help you. I'm just telling you there are times when regenerative medicine with platelets and stem cells is, to me, very miraculous.
I'm sorry, can I ask you, does it heal nerves and muscle tissues that damage? Because somebody just sliced into my right arm. I'm on my way to the hospital right now. Just last week, they sliced into my right arm, and they cut my artery, the femoral artery in my arm, and I lost almost all my blood, over half of it. And
my God, you poor guy.
And the nerves.
No, you gotta get all that. You gotta handle all that with your surgeon at the hospital. And when you're done, if you're having pain, then you'd come see me.
Okay.
God bless you, man. You've been through it. So sorry.
Oh, I thank you, sir. I accept that.
All right. And feel free to call me anytime. I'd love to talk to you.
Yeah, I'll call your office.
All right. Thank you.
Thanks, Mikhail.
All right, we're gonna go to Dave. We've got a few minutes left, so I'm going to give out the phone number to the studio again. I'd love to get a few more callers before we close the show. The number to the studio is 866-870-5752. I'm going to repeat it for you. It's 866-870-5752. I love your calls. If you're shy, give a fake name. Pretend it's your son or daughter or your father or your friend. And tell us about what's bothering you in your musculoskeletal system and see if I can help you using your platelets or your stem cells. Okay, we're going to go to Dave. Can you talk about nerve regeneration? I can talk about it, but I'm not sure I can help it. Let's talk about what's bothering you. So, Dave, what's your issue?
Well, a few years back, doctor, I had a parathyroid adenoma. Okay. And they went in and removed one of my parathyroid glands, and apparently the adenoma had enveloped the nerve to my right vocal cord. And so when they took out the adenoma, they took out the nerve to the vocal cord.
Okay.
And I was wondering if there's any way we could regrow that nerve so that my voice returns.
It is potentially possible. I don't do that work. Okay, so I'm not the guy to help you with that, but I can just give you some general information. So my father lost his voice. We were happy when that happened.
Now, my wife was too.
I am not kidding you. We love my dad. He was an amazing, amazing guy, but he had a very big voice. And God bless you, Dad. You're in heaven now, so it's all fine. But he had a bad temper, and he knew how to scream pretty loud. So when he lost his voice, everybody in the family, he's got a big family. He's probably at this point got 100 grandchildren, great-grandchildren, and blah, blah, blah. You know, big family from Chicago. And we used to laugh about it when he lost his voice. And it came back for him. You know, he had some nerve damage, but it wasn't like yours probably where the nerve was cut totally. And what I found over the years, the people like you, is if you get not physical therapy, but speech therapy, they can teach you how to use the vocal cord that is working to move against the one that's not working to get your voice better. Now you're already able to speak.
You know what
sorry?
they did, doctor? They injected the vocal cord that works with something that, I'm probably not saying it correctly, but it's something akin to Botox to make that vocal cord fatter, so it closed the space between the vocal cords.
That's where I was going to go next. Yeah.
Yeah, well,
perfect.
they did that to me about 3 times, and they said that's the best they could do.
Okay.
And so my voice.
Well, I think you're in good hands with your doctors. Another couple of things that you may want to try is B6. It's a vitamin B6 that helps regenerate nerves. I don't know if there's any possibility with yours. I don't know your case, but we're going to move on now, Dave. We've got a bunch of callers. We're going to go to Charles, who's got knee issues. Charles is Dr. Marc Darrow, and I do regenerative medicine. I've been doing it since my residency at UCLA about 25 years ago or so. And you've got knee problems, which is exactly what I do all day long. How long have your knees bothered you, Charles?
They've just been getting worse over the last 5 years. And I'm 82, and I'm self-employed. I'm a farmer, and I do the mechanical work half day.
Good.
And
good for you.
I wonder what I can't do if I come in and see you. What amount of time do I have to quit those activities so it will heal?
Okay, so that's a great question. I'm so glad you asked. I'm going to tell you what I do after I inject myself. You ready?
I'm ready.
I go out and do sports. I go out and do sports the same day. All right? I don't tell my patients to do that because I don't want them getting mad at me because I took their money and they're not feeling better. I know after doing this on myself for 25 years or so that things heal whether you're active or not. All right? But you may need more treatments than the guy who relaxes and doesn't do activities. And that will cost you more money and more treatments and more driving down to see me and make it more of like a pain in the butt for you to heal. So the best course of action is to stop activity of your knees. You know, it doesn't mean you can't walk around, but it means you're not going to be running up and down the farm and bending over and lifting things with your knees and all that stuff for a while. But that's up to you. I take care of lots of farmers, and they go, Doc, I got to get back to work tomorrow. And I go, okay, you got to do that. Everybody has their inconvenience about healing, and I made up this statement. Healing is inconvenient for everybody. Nobody wants to chill. They want to still be active and do anything they want to do and heal up. Well, they'll heal, but it may take a lot of treatments to get them there. Do you understand what I'm saying, Charles?
Yes, I do. Yes, and I understand that very well. And
so you do your best. I always tell people, whenever they ask me, how do I do this? How do I do that? I say, do your best. You know, some people who have knee problems live in a house with four levels of stairs. I just had one come in yesterday like that. They had a very linear house. They had 4 levels and they had stairs all the way. They said, what do I do? I said, you do it very slowly. You know, you got to do it. You got to do it. That's the end of the show, guys. For those of you that weren't able to talk to me who are waiting, you can call the office at 800-300-9300. I'll repeat it for you, 800-300-9300. Or you can go to the website and email me from there. It's www.lastemcells.com. God bless you all. Thank you, Nita, for being a good host. And thank you, staff, and Alex, and Suzette, and all you guys. We love you.
Thank you.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment